are experiencing some bad weather, so I am just fine with that, as it will help us get through this COVID-19 pandemic. We have put several strict measures in place for your safety and said that every measure to ensure that you follow our guidelines. And with that said, for those of you who are supposed to be in self-isolation, some of you are simply just not taking this seriously. One of the consequences, or some of the consequences that we put in place, would be fines. So in addition to fines, we are immediately taking away your driver's license. We will explore every opportunity that we put those measures in place on the current legislation that we have. So taking away your driver's license is another one of the consequences, in addition to the fines, for those of you that are not compliant with self-isolation. It's as simple as that. We will take the strictest measures that we have to protect our residents. In my remarks, we travel on those ferries and on our airlines to properly fill out those disclosure forms. Is not following the guidelines that we put in place for travelers within our province. And we need to be able to protect others against the spread of this pandemic. If we have to, as we said, and as Dr. Haggie and I have said many times, we will use the law. For me, it's sad, it's disappointing to even have to make those comments. Simply, we're asking you to stay home, to protect yourself and others. So many people in this world do not have a place to live. So many people in this world would love and would enjoy the opportunities that we have here in Newfoundland and Labrador. So simply staying home should not be something that you find difficult to do. But these measures, in the event that we have to use them to protect others, in some cases, the people of our province, every day, we continue, as Dr. Fitzgerald said, to see the numbers rise. The spread of COVID-19. I would like nothing more to contain and eventually stop the spread in the quickest way possible, to allow our entire province to get back to everyday life, a life that we've all worked extremely hard for, a life that includes all the activities that we enjoy with families and friends. But as we said many times, this is not days or weeks, this is potentially months away. And we can only make this happen if everyone follows the guidelines that the officer has outlined. It's only then we don't interact. If we keep a safe distance from one another, we can stop the spread. The more physical interaction we have with others, the more we keep it alive and the more it spreads. We are and we will examine the option we have to keep you and your loved ones safe. Public health officials are advised and are best cared for at home. And that is why we close this week in this province. What we have to keep, we have a number of we do as well. We have to recognize that we have put measures in place to protect and support you. We also have to put measures in place to protect and support our essential workers. We are permitting limited operation of regulated child care services. This is to help support and enable essential workers in providing essential child care services and other public .ca/ inform our child care centers, and we will work with them to facilitate a contract. Once again, this is our essential. Recognize the contribution that everyone is making to our province. is that the workplace is not a social gathering. Employees and employers are expected to follow all health protocols as best they can. Now, we've been getting questions, too, in preparing for food and sometimes a shortage of food for many residents in this situation within our province. We are global pandemic to support. We have several provincial departments that are involved, the Departments of Education, Skills and Labor, and Municipal Affairs and Environment. These groups will help support the funding for food security. This will include increase in the unprecedented costs for these community providers, such as transportation and supplies. The Department of Children, Seniors and Social Development, they will work in partner with Food First NL, who will be co-chairing this task force on this initiative. The group is currently mobilizing a variety of resources to make food available for those who need it. Also today, we're working with a company that's been doing and providing a service for Newfoundlanders and Labradorians for some 25 years. That is DRL buses. And they're coming off the road today. We will continue to work with the company to find a solution. We recognize that many people in our province use this service to provide transportation to services that they need for them and their families across our province. We will get through this situation that we find ourselves in. We will get to this working with the great team that we have. You know, it's said that on certain times within our province, that many people have said to me that it reminded them of a quote by a former president of the United States, and of course, one John F. Kennedy. And we're all very familiar with the quote, when he said that we ask not what your country can do for you, but what you can do for your country. Ask not what your country can do, but what you can do for your country. And that is us here in Canada. It's the same for us in Newfoundland and Labrador, is what is it that we can do for our province. You know, our actions today will determine the future and the within Newfoundland and Labrador. For those that are watching right now, I want to be very clear. Following the critical guidelines that we put in place, we will not hesitate to take further action. Be responsible and do not for 1 second think of jeopardizing the life of others. As Minister Haggie had said yesterday, the idea of people walking around oblivious to this is frustrating. It is frustrating to all of us. As a matter of fact, it's infuriating. The life of a human being is, and we must take quite seriously. And I'm pretty sure that the last thing that you want on your conscience when this is all said and done, that you did not take this seriously. The time to contain and to prevent this spread is now. So I want to thank you for this opportunity. I now turn it over to Minister Haggie.
Thank you very much, Premier. We have and are and will some considerable time on COVID-19 to the extent that it is possible to do so. They're designed really to enable you to do this from the comfort of your own home. So we've asked people to use the 811healthline.ca website or the government-located self-assessment tool to see, for those people who feel they may have been exposed or may have been at risk from their travel histories and are currently in isolation. But this is also, you must remember, flu and cold season. One of our challenges through our direct contact resources, and I'm thinking of 811 now and 911, is that not everybody who rings up necessarily has COVID-19, even though that may be the first and most foremost on their mind. So we are trying our best with 811 to work our way through that. And that service, the direct contact with RNs and trained professionals, has certainly been strained. And over the course of the last 10 days, we've leapfrogged putting extra lines on, putting extra staff on. And by the end of the day tomorrow, PhoneMed, who run that service for us, tell me they will have 25 full-time equivalent staff available to provide advice to people who have health concerns but are not urgent. The key here is also what 811 cannot do. 811 clear people to go back to work. 811 will not provide you with sick notes. It cannot do that. And for those of you who are government employees or employed in the public sector, we have been very clear that for respiratory symptoms of less than 2 weeks duration, you do not need a sick note. This is an unnecessary burden on 811, and I would ask you to really think twice before making these calls, because you're not going to get what you want out of it. The other feedback that we have had, interestingly enough, since yesterday, and the comments I felt constrained to make about the video, have been public health. We have had staff from each of the regions at so will contain this. We have, with all the technology we have available now, employers to work from home. And you only have your own department where significant numbers of people who would normally have been in are now working so from home remotely. I would ask point of view with the measures that have been put in under Dr. Fitzgerald's orders through the state of public health emergency, we have some of the most effective and stringent mechanisms in place to help with the last couple of days. Talk will be pursued vigorously. We would hope to rely on education and less traffic on the highway, less people in the office, that the message is getting out there. And I think the bulk of Newfoundlanders are actually doing what we ask. The safe thing for you to do now is, and with that, I think I'll conclude my remarks. Thank you very much, Premier.
Thank you, Dr. Haggie.
Things that diagnostic or therapeutic.
The College of the North Atlantic, those employees. So I understand right now they would stay there till late June. They are working from home, and the conditions and the regulations that those employees, would have in place are very similar to what you would see right here in our province. So I understand that it'll be June. We've been working with them through the College of North Atlantic, and they, as I said, they're working from their homes in Qatar.
Thank you. Our next question is from Peter Cohen from CBC. Please go ahead.
We've heard comments from the President of the United States saying he wants to see the United States back up and running by Easter. Dr. Haggie, a question for you. A lot of people are kind of anxious about how long these sorts of restrictions and lockdowns are going to last. Do you share his optimism?
No. We will be guided on our decisions by Dr. Fitzgerald's small but mighty team as to when it's safe and sensible to start easing these. And I think, quite frankly, from what I have heard, such discussions are really premature.
And as a follow-up question, we've seen one brewery in St. John's has been wanting to do home delivery of beer. Similar sorts of deliveries are happening, I think, in Ontario, for example, as a way to allow people to still get beer with limiting their ability to go out. But he's being told that he's not allowed to do that by the province. Why is that?
Yeah, these are regulations, that have been in place for quite some time, and we're. At some point, we would like to be able to change those regulations, but, we're in a situation right now where there's a number of priorities that we have to deal with, and as we go into the House tomorrow, we'll be dealing with, a number of pieces of legislation so that we can actually get loans, for our province and so on, which would require to continue to pay for the necessary services. At some point, these are regulatory changes, that if we see necessary in the future, once we get through this situation that we're into, that we could, potentially look at. It's something I know that through the Department of Finance, I understand that they would like to do, but getting to that maybe not as quickly as some of the people that are in that service, providing that service, would like to see. But right now, the priority for tomorrow's session will be on the immediate issues and the pressing issues that we're dealing with on behalf of the province.
Thank you. Our next question is from Holly Mackenzie Stutter from the Canadian Press. Please go ahead.
Hi, I'm just wondering if you can give details on any system in the works that would set up hotel rooms for doctors or other healthcare workers so they don't have to go home.
We have not had any specific requests. I tell a lie, there was one this morning. That is not something that we have looked at yet. We'd be happy to consider such options, but I think there are a variety of steps that might need to be considered first. So if it turns out that it's a sensible decision on public health grounds, we'll certainly look at that.
Thank you. And just a follow-up about the number of cases we have so far. Has anyone who's been diagnosed or tested positive recovered?
No, as of yet, nobody has reached that milestone.
Thank you. Our next question is from Angel Moore from APTN National News.
Hello, thank you very much. I understand the Premier was aware of the people on the Academic Ferry yesterday that traveled and did not declare. I spoke with some passengers who got off the ferry today, and they were all very surprised because they were expecting to be told to self-isolate, considering there was no social distancing on the ferry. And the people who did go into isolation on the ferry had to use the public washroom, they had to use the cafeteria. So everyone's gone home now, and the people I spoke to are going to self-isolate. But my question is, why was not Labrador Health, who was there, did not advise people to self-isolate?
Yeah, go ahead.
Labrador Grenfell had personnel there who approached every vehicle that left that ferry and provided them with information on what to do. And indeed, actually, my understanding is also there were personnel there from the Quebec Régie who were also there to assist with that.
Yes, but my follow-up was they were not asked to self-isolate.
The decision as to what to do under those circumstances is one for professionals to make, public health. There was information provided to them to guide their own particular circumstances. I would encourage them to read that. If they have any issues, 811 will be able to help them if the self-assessment tool doesn't. And I would encourage them to use any and all resources if they're in doubt.
Thank you. Our next question is from Patrick Butler from Radio Canada.
Hi. I just wondered if you could give any more details on what people should expect from the House sitting tomorrow. Any sort of anything concrete that you could announce before you talk about before you get in the House Assembly tomorrow?
Well, one of the things that I've just mentioned a few minutes ago was the fact that, given the situation that we're into, in order to keep the goods and services going within our province. Of course, in a province like Newfoundland and Labrador, it's not unusual at this time of the year that we would have to go out, and there would have been a borrowing program to a regular budgetary process that we would have been outlining. So right now we'll be seeking permission from the House members tomorrow to put the province in a position that they could go out and borrow. Helpful yesterday was the news from the Bank of Canada that they would actually support provinces up to 40% of credit. So tomorrow it's really getting the province in a position that we can continue providing services as we go out and seek credit, seek loans from our financing institution to support the services that we provide.
And if I could just ask, how many confirmed cases are there in the province right now?
4.
At the moment, there's 4 confirmed cases, and those are confirmed from the National Microbiology Lab. As I said, okay, sorry.
Thank you. Our next question is from Kellyanne Roberts from NTV News. Please go ahead.
Is there an update for schools? I know many students are getting concerned about public exams.
Yeah, so we, as we said when we announced school closures, last Tuesday, it was something that we were asking people to prepare that this could potentially be the end of the school year. I would say that we have a number of teachers that are doing a remarkable job in making sure that they're supporting students in their communities. It's a very different world for a K-12 system right now, as many students are working and getting their education from home, and the teachers are doing a very good job in support of those students. So right now it is too early to tell. We said that we would monitor this, but expecting that students would have to prepare this would be the end of the school year as they knew it. Provisions have been made for those that are not graduating this year to continue their education and getting the extra grade for this year. They move up next year, and we'll work with those that are preparing for graduation as they prepare for post-secondary education through this process. I will say that I give a big shout out to our teachers who are working very closely with those students, very mindful that many of them are preparing for graduation.
Dr. Fitzgerald, you say that we're going to be able to confirm more here now. Are we becoming a national lab here in Newfoundland and Labrador?
So our lab, the Newfoundland and Labrador Public Health and Microbiology Lab, has been doing the tests, and once there's a verification or validation process that's in place, and so they have met those requirements to be able to have positive, confirm positive cases here.
Thank you. Our next question is from Ben Murphy from VOCM News. Please go ahead.
Premier, getting a lot of messages from substitute teachers who are concerned, saying they haven't heard a whole lot about what will be done for them. Many saying they're not getting paid for days that they were booked. What can you say to just help alleviate some of the concerns of substitute teachers around the problem?
Yeah, so we want to work with our substitute teachers. They play a very valuable service to our K-12 system. Also recognizing that the federal government are going through a process right now to support all individuals that find themselves without a job based on the decision of COVID-19. The application process should be available, as the Prime Minister has been saying earlier today, around April the 6th of this year. And so there will be a full program, a suite of programs available for those that find themselves without a job because of the decisions made by COVID-19. Also, from a provincial support, we want to work through our substitute teachers, working with NLTA, which would be their association.
And hearing rumors, and I'll emphasize rumors, the town of Cartwright is blocking anyone who left the community as of yesterday, March 24th, from re-entering. Have you heard anything on that, or can you speak to that?
Yeah, I understand there's a state of emergency in Cartwright right now, and if you are familiar with the community itself, is based on the state of emergency that they put in place. This is largely around some of the vulnerable people that they have in their community, people with suppressed immune systems. I think that's even outlined in their state of emergency. So the community in this particular situation felt it was necessary to put those measures in place to work with the residents and similar to what we've done as a province, similar to what we've done as a country in making sure that when people enter the community, that indeed in this case would be to keep people out, that would reduce the spread of COVID-19 to the community of Cartwright. They're in a position that they can actually do that, and I understand that they're looking at the state of emergency as one mechanism to be able to do that.
Operator, can you find out if we have any further questions?
We only have 2 left in the queue.
Okay, thank you.
So the next question is from Peter Cohen from CBC. Please go ahead.
Question about unregulated daycare spaces. These are usually in people's homes. They've been allowed to stay open, but I know a lot of parents have decided to keep their kids out under the principles of social distancing, but yet there's no financial help available for these places because they're unregulated. Is there anything you're going to do to either help make sure that parents don't have to continue paying for a service they're not using, or making sure that these child care providers aren't losing out on a vital source of income?
Yeah, over the weekend, we made an announcement that, especially those that are the regulated system, that the parents would not have to pay to keep those spaces available, that indeed anyone that did pay, there would be refunds. In the unregulated system, that is something that we do not provide, operating grants and subsidies, that they work in an unregulated system. So this is really a contract that occurs between the family and that unregulated provider. We work very closely with the regulated system, but in those that are in the unregulated space, that we expect everyone to provide the social distancing, physical distancing that's required to make sure that the child care is provided in a safe way.
But why not provide the same sort of help you're providing to regulated childcare providers to some of these unregulated ones as well?
Those, it's an option that people make a decision if they want to be an unregulated or a regulated childcare provider. In many cases, not everyone makes a decision to be a regulated childcare provider. That's a decision that's made by the operator. Now, in some cases here, we would see that the federal government may have programs that would be available through the EI system, as an example, to support those individuals, not just the unregulated childcare providers, but all individuals in our province and throughout the country.
The time for questions has ended. The last caller, if you would email me your question, I will get your answer as soon as possible. Thank you, everybody, for attending.
Thank you. Your conference